Dear viewers, this is part 2 of the three-part series on transplantation in the Medicine for Anyone in the YouTube channel. Heart valves. What are heart valves? Heart valves are marvels of natural engineering as they last a lifetime, even for few hours after death. Valve damage. Sometimes valves get diseased and do not work right. They might not open all the way, leading to reduced flow of blood, or they might have problem closing, leading to leakage of blood backwards. Due to these problems, the heart will have to work harder to pump the same amount of blood, and the blood may back up in the lungs. Therefore, valve repair or replacement is required. Heart valves get damaged in various diseases either because of age, infection, or failure of previous heart valves operations. Sometimes, as the problem exists by birth, the valve need replacement even for newborns. Rheumatic heart disease is one of the key reasons for valve-related problems. Need of valve transplantation. Every year, more than 1 lakh heart valve procedures are being done worldwide, and the number is expected to go as much as 8 lakhs by 2050. If valve is to be replaced, then there are options of mechanical or biological transplants. The biological valves obtained from human beings through cadaveric donation, called homograft, are closest to the ideal valve as they are silent, last longer, do not require anticoagulation, and are comparatively free of complications. Out of the 4 valves in the heart, 95% of valve replacements are performed for mitral or aortic valves. Cadaveric valve donation. In case of a cadaveric donor, heart valves are one of the organs that can be harvested. Heart valves must be recovered within 15 hours if the body is not refrigerated, or within 24 hours if the body is refrigerated within 12 hours after death. Even a general surgeon can extract the heart and send it to the specialized center within required temperature and time frame. Once it reaches the specialized center of transplant, the experts can extract valves by careful aseptic dissection from the donor heart. Then, valves are inspected carefully by the medical team for the suitability of that valve for preservation and future use in the patient. After that, valves are packaged in aseptic allograft packaging and then stored at minus 150 degrees centigrade in liquid nitrogen as freezed valve, and they can be utilized within next 10 years. Advantage of valve transplant. The benefit of human heart valve is that they are closest to natural valves and life-saving. After transplantation, the patient does not require blood thinners, that is anticoagulants, which makes it particularly beneficial for young children, pregnant women, and older age group. They provide excellent hemodynamic performance due to a more natural function of the surrounding structures. However, with limited number of organ donors, it is challenging to find homografts for the needy patients requiring valve transplant. It is indeed the need of the hour to develop homograft banks and raise awareness of valve transplant and organ donation. So, dear listeners, by the way, this educational video is made possible by PrescribeOn, the makers of e-prescription software for digital prescriptions, available freely for doctors on the website www.prescribeon.com. Doctors who are interested in this e-prescription can freely avail of its vast collection of more than 100,000 e-prescriptions. Liver transplantation. Conditions requiring liver transplantation are acute hepatic necrosis. This is when the tissue in the liver dies. Possible reasons include acute infections and reactions to medicine, drugs, or toxins. Biliary atresia, that is, biliary tree is ill developed. This is a rare disease of the liver and bile ducts that occurs in newborns. Viral hepatitis, that is severe hepatitis B or C infection. liver cancers, and autoimmune hepatitis. A redness or swelling, that is inflammation of the liver. It happens when the body's disease fighting system, that is immune system, attacks the liver. Bone marrow transplantation. New marrow or peripheral stem cells are required when the bone marrow is destroyed by chemotherapy and or radiation therapy. Other indications are various cancers, lymphoma, multiple myeloma, Hodgkin's disease, germ cell cancer in testes or ovaries, or certain types of leukemia. Bone marrow transplantation was the original term used to describe the collection and transplantation of hematopoietic stem cells. But with the demonstration that peripheral blood and umbilical cord blood are also useful sources of stem cells, hematopoietic cell transplantation has become the preferred term for this process. The use of hematopoietic cell transplantation is increasing as it becomes safer and applicable to more diseases and as donor availability expands. Worldwide, about 100,000 transplants were performed in 2020. Several features of the hematopoietic stem cell make transplantation clinically practical. Its remarkable regenerative capacity, its ability to home, that is, automatically finds its way to the bone marrow space following intravenous injection, and the ability of the stem cell to be cryopreserved, that is, kept frozen at very low temperatures. In humans, transplantation of a small percentage of a donor's bone marrow volume regularly results in complete and sustained replacement of the recipient's entire lymphohematopoietic system, including all red cells, granulocytes, BNT lymphocytes, and platelets, as well as cells comprising the fixed macrophage population, including Kupffer cells of the liver, pulmonary alveolar macrophages, osteoclasts, and Langerhans cells of the skin. Blood cells harvesting. Bone marrow aspirated from the posterior and anterior iliac crest, that is the top portion of hip bones, initially was the source of hematopoietic stem cells for transplantation. Nowadays, it is possible to harvest adequate numbers of stem cells from the peripheral blood for transplantation. Umbilical cord blood, that is the connecting cord between the mother and the fetus, contains a high concentration of hematopoietic progenitor, that is mother cells, allowing for its use as a source of stem cells for transplantation. Procedure. To prepare for a stem cell transplant, chemotherapy is administered to kill the diseased cells and malfunctioning bone marrow. Then, transplanted blood stem cells are put into bloodstream. The transplanted stem cells find their way to the bone marrow where, ideally, they begin producing new healthy blood cells. Lung transplantation required in bilateral lung transplant, that is, lung of both sides transplanted for cystic fibrosis and bronchiectasis. Cystic fibrosis is a disorder that damages the lungs, digestive tract, and other organs. It is an inherited disease caused by a defective gene that can be passed from generation to generation. Cystic fibrosis affects the cells that produce mucus, sweat, and digestive juices. Bronchiectasis is a long-term condition where the airways of the lungs become widened, leading to a buildup of excess mucus that can make the lungs more vulnerable to infection. The most common symptoms of bronchiectasis include a persistent cough that usually brings up phlegm, that is sputum, and shortness of breath. Single lung transplant for emphysema and pulmonary fibrosis. Emphysema is a lung condition that causes shortness of breath. In people with emphysema, the air sacs in the lungs, that is alveoli, are damaged. Over time, the inner walls of the air sacs weaken and rupture, creating large air spaces instead of many small ones. Pulmonary fibrosis is a lung disease that occurs when lung tissue becomes damaged and scarred. This thickened, stiff tissue makes it more difficult for the lungs to work properly, resulting in shortness of breath. Heart or lung transplant. Severe lung diseases already indicated above, in addition to severe heart disease, leading to poor left ventricular function or irreversible right ventricular function. Liver and heart transplant patients can hope to live up to 1 to 15 years. Intestine. Intestinal transplants are most frequently done for patients with intestinal failure who develop intractable total parenteral nutrition related complications. Cornea, the transparent part of the front of eye that covers the iris and the pupil and allows light to enter the inside. Indications for corneal transplantation are treatment of bullous keratopathy, keratoconus, keratitis, and corneal chemical burns. Keratoconus occurs when the cornea thins and gradually bulges outward into a cone shape. A cone-shaped cornea causes blurred vision and may cause sensitivity to light and glare. Keratitis is inflammation in the cornea. Procedure. Cornea transplant is a procedure that replaces the cornea. During this procedure, the surgeon removes damaged or diseased corneal tissue. Healthy corneal tissue from the eye of a deceased human donor replaces the damaged cornea. For many people, cornea transplant surgery restores clear vision and improves their quality of life. So, dear viewers, this is the end of part 2 of the three-part series on transplantation in the Medicine for Anyone in the YouTube channel. Thank you for watching.